Hello, this is Ryan Wicks again, trying to wrap up the video series I did on COVID-19 insights from simple models. And so the core three videos I already did, and they were more focused on objective discussion and presentation of the models, the data that's out there, as well as the resources that are available to help individuals and the public in general cope during this time of the pandemic. The COVID-19 pandemic. And so I wanted to take some time to this is more like a video blog, I guess. It's more of like a discussion about that presentation, those facts, and discuss different interpretations, and try to just discuss normative statements that can be made about should actions, or what are just some of those dynamics. Yeah, because I try to be very objective and talk about just the science and the policy and the resources in those videos, but I think there's room for some subjective discussion, and I wanted to discuss that dynamic from a few different perspectives. The project for me was something that for me, I guess maybe it was a way of coping, getting some perspective for myself. And the aim of doing the presentation was being able to share that perspective and those models with other people, and to feel like maybe I was doing something. Well, I don't know how much impact it'll actually have. It's just certainly there was curiosity on my end. Certainly they were tools that were helping me, and I figured could be helpful to other people, and I hope helpful to others. So I did want to share it. Whether it was the resources, the modeling, just educational content. It's certainly something we've all been struggling with, so I wanted to put that together. The big takeaways for me, I remember spending a lot of time trying to figure out, okay, how do I grapple with the risks? How do I, one, understand objectively, filter, objective truth from hype, from, perspectives that were overplaying the risk or underplaying the risk, as an individual, to society, and things like that. So I wanted to, and I'd done some population modeling in the past, so I wanted to dive into that a little bit. And part of it was just me being curious. Part of it was me trying to develop tools for myself. And certainly I put together that table that talked about risk for myself, to individuals, or a cluster of individuals interact regularly, and how to do take the raw data and how to get some semblance of a model about a portion of the population are currently infectious and things like that, from an epidemiological standpoint. And I remember having this eureka moment when I realized that I just put together these theoretical models that are well founded in literature, in theory, as well as that are backed up by observations. Certainly not perfect, but pretty good, about as objective as, on the right track, as good as I could do. There are better models out there, but then the models I came up with weren't too far off base, I don't think, from what I was reading in the literature that I reviewed and referenced in my videos. But then I had this eureka moment when I realized that, hey, a lot of those models show that behavior or the risk to the public doesn't depend on current caseload. And that was really eye-opening for me, that a lot of what we try to do, and the reason it's a big public issue, is not about the risk to myself or people that I care about, although that is something I want to do, is take care of my friends and family, but also just the general public. And so I wanted to make sure that, unless I considered that there should be an exception for me, right, or that other people are more privileged than me and don't necessarily have to put in as much effort, that, I was trying to think of some normative statements that, what are some criteria that we could all adopt and say, okay, this is what's reasonable, not reasonable. And if we all did this, then we would essentially solve the pandemic in the short term until we had either herd immunity, or that would develop over years and years and years, or got a vaccine to be able to accelerate that. Yeah, keep people as safe as possible. And so I when I realized that, I was like, okay, well, if we all had this normative behavior where we had this certain threshold of like precautions in terms of wearing masks and um, socially distancing ourselves, isolating ourselves, and taking testing precautions and things like that, that just those simple steps would go a long way. Um, and then when I started looking at the logistic curves, I was like, all right, well, then I would expect the, um, different rates of COVID cases to not accelerate, that they would be dampened. And the R naughts would be less than one, replication number would be less than one. I was like, all right, well, that's the criteria. And so if we can understand the science and the parameters around that and how to do that effectively, then, there's some risk, but there's always risk. But essentially we're doing, if everyone did that, then you would effectively be safeguarding the public, and everyone would be, if everyone did that, then that would be everyone contributing to keeping everyone else in the community safe, and not letting this disease spread out of control. And when I started looking at the logistic models, not only would that prevent the rate being really low, and it's just the total cases that would ever, as long as you held that, had those restrictions in place until herd immunity or artificial herd immunity through the vaccines was achieved, you'd have difference in millions, hundreds of millions of people being infected versus not infected. Like the difference was huge. And then, whatever 0.7% or 1% of that is the number of people that you would save. Which I think is really important to remember, that it's not just about, people that we've lost and could have saved, but all the precautions that we've been taking have made a difference, and the models show that. But those, it's difficult because those, and the other thing that was interesting is that those restrictions, because those social behavioral shifts, those restrictions that we have on ourselves, that the government would have regulations for, however you want to implement it, those behavioral shifts would aren't dependent on case numbers, because as soon as they're relaxed over time, the caseloads start growing again. So they have to be maintained until you have a certain level of immunity that the population is built up one way or another. And there's three ways. One is people just die from it. They can't tolerate the disease. The other is that there's enough support and medical support for individuals as they get sick that they can survive and build up immunity, so they don't have to worry about getting sick again, or there's vaccines, right? Not to be cold, but I guess those are the three major ways to build up enough immunity within the population. So I thought that was really helpful for me for developing normative statements about how I can, as long as I'm hitting these criteria, that I'm keeping people safe, and then really don't have to work like I just have to say, all right, that's just risk I just have to inherit. I also think there's an interesting thing about that's like this tragedy of the commons, right? That I said, if everyone had these criteria that they were following, these behavioral shifts, if everyone just did this like same mode of lifestyle, that would work. And in theory, that would work. But we know that not everyone's the same. People adopt them at different rates. People are more risk averse, less risk averse, depending on their personal preferences. But certainly there's a threshold, there's this aggregate behavior that happens in a society where if too many people are taking too many risks, then even if a lot of people are taking precautions, what those normative statements are, if you had a normative statement, a normative mode of behavior A that just says if everyone does this, everyone's fine. If only 60% of people do it, then there's some threshold where if not enough people do that, if it's right at the threshold of what's barely acceptable, and just like only 80% of people adopt it and 20% of people don't and take more risks than that, it also depends on the extremity of how extreme the risk is. It just won't be enough. And you might actually, depending on the case, you could have linear growth, but really high linear growth, which we might be seeing. It's hard to, I've been looking at the data in the last few weeks. That might be the case now because case loads got so high. And so criteria people were taking, there's a lot of complexity there. But in any case, I don't want to get into all those different cases of how, what kind of behavior you would have in the models for caseloads within a community. But my point is that there's this, like, it's a tragedy of the commons problem where people, if someone if there's a public service like roads or something that a lot of people invest in, just be, once they're paid for it, no one else has to pay for them, beyond maintenance. But like if people are investing in some public good that's meant to be there for the public, then and everyone has access to it, then there could be people that are paying more for it than others, right? And the idea is that, well, if it's a public good, then we should have, to be fair, it would be nice if everyone chipped in for it. And in some cases, like we don't regulate that. In some cases, government does regulate that. There's things like taxes for paying for the military, defense, and any number of things, right? So park services and roads and all these other things that are public goods. And in a sense, you can think of like safety in the case of pandemic as being a public good, right? With this certain perspective. It's not, I don't like to think of it as in terms of like a commercial commodity, but certainly there's some benefit to the society that if you're taking more precautions, you're spreading the disease less. And so if you're taking less precautions, you tend to spread the disease more. If you like, to bin people or bin individuals based on their risk aversion, or how many precautions they're taking, social behavioral shifts they're taking to protect the public. And so there can be many cases, which is the case where we expect this distribution of risks and behavioral patterns that people will take. And so it's interesting to think about those that would take. You could say those that are taking less risks, like if you're not even wearing masks, you're not social distancing, you're not changing social behaviors in any way at all, then you're it might feel safer to you if cases stay low, but that cases staying low and that personal safety that you're being afforded is being bought by everyone else that's taking those precautions. So there's like this question of fairness in terms of buying that safety. And the interesting thing is it's not strictly you could say it's a personal choice, but it's not strictly a personal choice. We know that individual behaviors and aggregate social behaviors impact everyone else's lifestyle. It's not separated in a very intrinsic and fundamental way that can't really be avoided without testing that's available on an hourly basis, kind of thing. And I thought that was, that's interesting. So there's this question about like, well, how should we respond? What policies should we have in place? How much fair should we try to make it? How much should we do to protect others, and how much should we mandate and try to enforce other people to protect others, right? And this gets down to the idea of a lot of ideas about personal freedom and government reach and organizational reach and social influence. That it's a hard problem because there's this fundamentally there's the nature to where we're all are interconnected, whether pandemic or not, right? Even outside of a pandemic, we're all interconnected. And this is a more general question about how much do we say individuals have social responsibility for other people in their community. And you can think about that at varying scales, right? You can think about that as the family scale. You can think about that at the town scale, small community. You can think about it at the county scale, the state scale, country scale, international scale. And there's a lot of interesting questions there. And so I think that how to respond to a pandemic is certainly one of those nuanced problems that is really hard to tackle from a ethical perspective. Because I think we can all agree that like there's certainly we want to have personal freedom, and that's paramount, that individuals have sovereignty. But there are also plenty of behaviors that we can think of just in general where an individual's behavior can negatively impact and harm other people, therefore infringing upon their sovereignty and their right to life and happiness. And to some degree, it's kind of like why we kind of agree as humans to have governments and societies where we have like these agreed upon rules. And like, all right, here are the bare minimums. Beyond that, you can do whatever you want. And where that bare minimum is, I think, really varies. So let me, like, for instance, I think there are two extremes in terms of that's in general, right? And so when thinking about the pandemic, there are these two extreme perspectives that I don't think are necessarily opposed. I don't want to set up this like directionally polar directions in terms of like trying to set that dynamic up, or that that I don't want to frame it that way, because I don't even think it's not, I don't think it's strictly true. That you can have right about, so anyways, I just want to frame that as says I'm going to give two extreme perspectives, but as examples, but I don't necessarily think that they are diametrically opposed, although there are certainly modes of those behaviors that would come from those normative statements that are mutually exclusive. Like you can't both be wearing shoes and not wearing shoes, or whatever it is, right? So like you either have to have shoes on or not have shoes on, but you could anyways, there's certain cases that exist, right, where things are mutually exclusive and things aren't mutually exclusive. But having shoes on and not having shoes on, maybe you could say, aren't directly polar opinions, and the people wear shoes, don't wear shoes, can't have some overlap. Like maybe you wear laces on top of your feet or something, right? Or like no soles or something. Don't know. That's an abstract concept. But the two specific cases for COVID-19 and a pandemic like this would be, one is one that's incredibly regulatory and restrictive, and I guess controlling, and is very risk averse. You could, there's a bunch of different ways you could frame it, and how you want to frame it, I guess, is a little bit nebulous. But you could say, have this perspective where it's really important that everybody take a lot of precautions, avoid taking risks where they could be transmitting the disease to other people. So wearing masks, sanitation, isolation, shutting businesses down, social distancing, a lot of extra precautions to really, really dampen and crack down on the spread of the disease. Where theoretically, if everyone was in complete isolation for like 3 or 4 weeks, if you don't have animals being able to be carriers, the disease would just stop. You wouldn't have any more cases within a given region. And then you'd have people coming out of the region. But that requires so much regulation and a complete lockdown. Right, so that's an extreme case, and maybe if you didn't have that, you just said, all right, people can go about their business, but everyone has to have these. Maybe you have really high penalties for not wearing masks in public or whatever it is, and you could have the moral argument or the ethical argument that it's certainly, you could have the perspective that it's a pain to not have to go to the bar or socialize with friends, or have celebrate holidays together. But you could say that if someone does that, right, you could have this like judgmental attitude where it's, there's some truth here, which is that those things that are otherwise pleasurable and good to do for an individual, even if an individual is really willing to take on that risk, imposes a risk on everyone else, and they don't acquiesce to. It's getting imposed upon them. And right, because if people are mixing and mingling, if you're sick, you can still transmit it to a person, even if you're taking precautions. So if you're increasing the likelihood that you contract it and you're not taking precautions to prevent it from spreading to other individuals, you're projecting that risk on others. Right, so you could say, I want to be able to, get to, go to a bar and then eat out at restaurants a lot, and then I want to be able to go to the park and not have to wear a mask, right? Because I don't want to have to do that. And so that's probably more enjoyable. But certainly, whatever the thing is that you say, I want to do, but we know the science shows this is risky, you say, if someone engages in that behavior, you could say, well, you were literally, there's this pandemic that is a public enemy that is killing people by the millions globally, certainly locally by the thousands. And so you are, you could say like, oh, you're making a deal with the devil or something like that, right? Like where you're saying, all right, well, I'm willing to put other people at risk so I can have this thing for myself, right? And you're risking having an infection that you will literally be using your body to mass produce a pathogen that you will then use your body to transmit to other people. Like it just has this very like if you think about it that mode, it's like this very, dark sci-fi-esque thing. But the sense is, to some degree, there's an element of, you could say there's an element of truth there. You could have that perspective. Right? If you are going out taking lots of risks and not trying to protect the public, you are offering your body up to be used as a disease transmission engine. So you can do the things that you want to do and not take on responsibility to protect others, right? And so that's a very extreme perspective, very, very extreme perspective. And I would argue not fair, right? Another extreme perspective that you could take is that it's not your responsibility at all to try to protect other people. You could take on the perspective that everyone dies, and certainly, disease and even a pandemic is heartbreaking and sad. And by no means would you want to perpetuate it, but you can certainly make the argument that it's beyond your realm of responsibility, personal responsibility, that disease and even pandemics are just part of life. That there are certain risks that occur just in life, and you can never avoid risk. And that there is a certain, and then it's not right for you to sacrifice personal freedom or personal pleasure to necessarily have to try to do everything in your power to mitigate risk to everyone, right? It's not that you're not actively trying to cause harm. You're just trying to live your life. And if science talks about how that actually puts people at risk, then, that's unfortunate, but it's fundamentally, principally not your responsibility. And maybe if you knew you were sick, you'd do everything to protect people and isolate yourself, but you're not going to, without any a priori reason, take any change, right? And especially, like, you can also think of cases where if you have reason to believe that you only have a few years left to live, or the people you might want to interact with only have a few years left to live, and a pandemic, for instance, like this, is going to last a year and a half. Is that really how you want to spend the last year and a half of your life, or honor their life? That in some ways you're sacrificing, and that has you can't really put a money value on it, but it has, we're not really talking about money in any of these cases. Or I don't want to talk about the economics of shutting down business. It's not for this discussion. But certainly there's a cost, there's a human cost to taking to isolation, to averting risk. And so you can have the extreme perspective that it's no one's responsibility, that it's just unfortunate, it's the way things go. And I think, right, that most people can see that there is this, that if we were to arrive in like some kind of like, a normative statement that most people would accept is somewhere in between those two extremes, that there is some measure of responsibility, but there's also some level of, for protecting others, but there's also some level at which there's, you shouldn't do anything else. Like you can always do more, and that there's some trade-off and there's some balance there. And certainly, like, I can take on the perspective that, I tend to be more risk averse. I want to make sure that I'm not hurting others, and I make sure I'm not spreading an infection to other people. And I do want to protect myself also. Certainly, I fear for myself, and I fear for people, my immediate friends and family, but I also care for the public in general, people that I don't know personally. I recognize that they have value just as much as I do. That they are important, and even if I don't know them personally, it's important for me to do what I can to protect them. I tend to be more risk averse, but I can certainly see a case where, let's say, if our best science suggested that it was going to be 20 years before we would get through a pandemic, and you'd have to get through this the best way possible, you have to have these really tight restrictions for 20 years. I'd be like, not entirely sure that's the best mode, right? And so certainly I can see that at some point, even though I'm risk averse, tend to be more risk averse in what I want to do for myself, right? If I was in a vacuum, didn't have to think about normative statements for anyone else, so normative statements about how I should, whether I should support, what policies I should support or not support. I think for myself personally, 20 years might be too much, because there's a certain portion of my life that amount of sacrifice is too high. Probably, I'm not entirely sure how I would feel about that. My gut instinct is 20 years would be too much, but maybe a year and a half, I can manage. And certainly for me, the offset for being able to socially distance, where I only see people outside, wearing only masks and going hiking with individuals outside and playing games online through digital media, and certainly the social interactions I get at work and working outside with other individuals, the field work that I do outside in my professional, as part of my job, that's enough for me. It's not ideal. I really would like to be able to hang out inside people's houses, although I decide that's too risky in many cases. I've done this modeling work that shows in many cases that is, except for like a really, really small exceptions if you were pretty strict about what you were doing. Yeah, and just, I think, that for me, that's a lot easier than for those that get a lot of enjoyment out of personal interaction in public spaces, like going dancing, or playing sports outside with large groups of people, or going to sporting events. I certainly love playing sports, but that's something that I've kind of put on the back burner. I think it's too risky. Maybe in small groups again, but whatever it is, there's certain activities that others I can understand differences in personalities and the way people will relate to other people, and that online interactions just aren't good social support mechanisms, and that taking the steps necessary to protect the public or to protect yourself or family members might be higher cost, might be the same actual physical action, but it might be a larger cost for some individuals. And learning to adapt to. So certainly when we talk about fairness, right, about saying, well, here's the normative statement, if everyone did this, then it would protect everyone. It's right, that's hard to say that that's fair just because it's the same action. It makes a difference. That same action has a different cost to different individuals. Certainly if I had children or family member that were really, really close to me that I would have to travel to see, or I'd have to take more risks to see, that have a higher cost on me to stay separate from them. I've certainly heard from folks that do that, and have had to make those sacrifices, especially those that work in the medical field trying to save lives. And that's a big sacrifice that they're making to protect others. But certainly that's not everyone, right? Because if you're not working in a medical profession, right, you don't necessarily have to do that, but it is then you're taking on more risk that then gets projected back out into the public. And there's certainly things that you can do, right? For myself, I think it's certainly reasonable to say for a year and a half, I can hike with folks outside once a week, trying to stay in the same one or two people, or at least separate those hikes by a week, wear masks, socialize online, and find innovative ways of like sending cards and playing, playing, chess over the internet, or video games over the internet, or whatever it is. Just doing video chats. And I enjoy my own time. That's, while I do miss a lot of things, like playing sports outside and being able to socialize in multiple friends' houses, and and being able to see family more and to go on trips together, and that's hard to let go. But for a year and a half, I think to protect my community members and to do my part to protect the public and to protect my family, it's certainly something I'm willing to do. And I would argue that it's certainly reasonable for most folks to do. And even if not everyone can do that, if the vast majority of people can do that, then that will make a huge difference, and that will be sufficient. Certainly there were thresholds, by which I was talking about daily number of interactions where, there's a little bit of flexibility, very, very little in there. But if most people do that and are on the extra cautious side, that even those that take more risk, it's, I can imagine a scenario, it seems reasonable looking at like the way those, if I change those parameters, the way those risks scale and shift with response to behavioral changes, that there's certainly, it's likely that there exist scenarios where that can be okay. Again, it's not not as good as everyone taking those perfect precautions, but still really good. And that brings me to my last point, which is that, I think everyone can do something. Right? Everyone can do something. Like whatever it is, if taking precautions, if the precaution is wear a mask everywhere you go, only see one other person outside your household, just you live with your nuclear family, your partner, you have 2 kids, and you only ever interact with one other household. Maybe there's another couple and they have a kid, right? And your kids play together, and then you guys get together on the weekend, but you only make it once a week, right? Something like that. And then all of you are super cautious about going to the grocery store only for that, and you all work remotely, and you don't interact with many other people, where you couldn't be a vector between those groups that you each interact with. Right? If that, you could say that's like the standard, right? But even if for whatever reason you're in a space where that's been really hard to do, or you haven't wanted to restrict down to that, and you just haven't for whatever reason, right? There's many different reasons why people said they can't or don't want to or decide not to for whatever reason. There's something that you can do, right? And I think trying to consistently push that envelope of how can I keep my community members safe is important, because my perspective that I would argue is that we all have some responsibility to protect ourselves. Right? We have some responsibility to protect ourselves, which is felt very instinctively, but also there's a real moral argument for protecting yourself and protecting your family, but also your community member, your community, your friends and family, the people that you would interact with, keeping them safe, and even keeping the people safe that you don't know personally. I think there's some responsibility there. And my point is, even if you have a hard time doing what's like ideal, doing something makes a huge difference, right? Because the way the disease spreads, like even if you think back to the model, R naught of 1.5 to R naught 2.5, the total number of infections was off by 1.5, 2.5, R naught of replication number of 2.5 was twice as high almost for the total number of infections as 1.5. And 1.5 is logistic growth, where the disease grows out of control, right? It is a real public health challenge, but still, and we talk, there's a lot of talk about how many people have died because we've had such high infection rates in the United States and other regions around the world. And there was more that could have been done. And that is sad. But there's also this other aspect that you can look at the glass half full, where there were a lot of people, it could have been worse if no one had done nothing. And there were, this was a very hard, challenging situation for every member of the global community to deal with, and try to figure out and try to navigate. And so certainly there are things we could have done, but once the disease Pandora's box was open, it was out in the world and prolific. You can't really, it's unreasonable, I think, although it may be possible, to completely eradicate it before you get a vaccine or something like that, just from social distancing and taking like PPE, mask wearing precautions and whatnot. Like, it's certainly probably possible, but virtually impossible because of such a high cost that would be required to do it. It's certainly very unlikely that everyone would be synchronized in their efforts to do it, and that well coordinated. And so there was more that could have been done, for sure. It wasn't likely that you would completely eradicate it, but more that could have been done. But I think it's important to look at the glass half full. Everything that anyone ever did to be able to take some level of precaution, whether they completely isolated and worked just from home and only ordered groceries online and didn't see anyone, right? And was super cautious about sanitizing, a gasoline nozzle if they're pumping gas or whatever it is, versus someone that just said, okay, well, I'm still going to see my friends and family, but I'm going to, not go to large publicly crowded spaces. That still probably is a behavior pattern that on average will tend to spread the disease more than inhibit it, but it certainly inhibits it to some degree, right? And so aggregately together, everything that everyone's done to try to make sacrifices has made a difference. And it's made that difference between, let's say it's 1.5, replication number of 1.5 to 2.5 over certain periods of time. Like that, like we're still doing better than 1.5. We've dampened the replication number out in many cases to where cases are extremely low in some parts of the United States and other regions of the world. But even if it was worse, like everything that everyone's ever done has made a huge difference. And so I would encourage people not to get discouraged and consistently say, okay, you know, this is hard. This is difficult. I'm tired. I want this to be over. But if it helps encourage you, everything you've done, every sacrifice you've made has made a difference. Existentially, right? I think we don't have the data to know that for every single person's individual action, no one's tracking that. We can't know what could have been or would have been, but we know statistically that those aggregate behaviors that everyone's participated in, some kind of, you know, precautions individuals have taken to protect others, on average have made a difference. So I would say existentially it's made a difference. You can make the same argument that even if you never transmitted the disease to someone, but you were taking risks that certainly made it likely that you were going to, like existentially, you know, you're also responsible for that spread. So, you know, those are like two like perspectives on that, but maybe a neutral perspective is that we are all responsible for the outcome that we are seeing. And that's both the good and the bad. So certainly if you find yourself getting discouraged, and I find myself getting discouraged, I need to think about everything that I've done and that we've done collectively to protect others. And it's made a huge difference. And if there's things that I can think of that I can do better, or things that, you know, we can think of that we can do better, you can do better, you know, this isn't over. There's still things that we can do. And in the coming months, you know, the decisions that we make in the context of a pandemic will make a difference, just as it does in all life. Everything we do makes a difference, even if we don't always know it. So certainly trying to think about critically about what's that threshold of risk, how much am I trying to do to protect other people? I would argue it's, you know, we need to do something. Certainly I would argue strongly for it's not that hard to wear a mask and stay socially distanced, and only limit interactions with others, participate in testing programs if you have them, and just follow the general guidelines. I don't think they're that hard, but and I would argue strongly that, you know, if it feels hard to you, you can find ways to make it work. But whatever you do, every little bit helps. And you should feel thankful towards yourself, right? Or prideful, or, you know, not to be hubris, but some level of satisfaction in anything that we've done or that we can do. And to be optimistic about trying to protect community members, even if you don't know them. You know, this is something we've all struggled to together, and this is something we've all struggled with together. And whatever we can do, whatever small part makes a difference. So, yeah, I have nothing else left to say. I've repeated myself a little bit, trying to come at it at different angles. But I think people are wonderful, and I think everyone's in a different spot. I think there are things that we all know we can do to protect each other, and also consider our own health and happiness and well-being. And certainly there's maybe some unique solutions that we can, you know, come up with. People are innovators. Sometimes you can have your cake and eat it too. You try to think of and imagine new ways of doing things. So, thank you to everything everyone's ever done to try to protect our community members, whether it's from a pandemic, from a safety and law enforcement perspective, to a emergency response teams. to doctors that are trying to keep everyone healthy. Um, yeah, thank you. And we're in this together. So do what you can and be well.